Hi, I'm Lynn Kettell-Slifer here for another round of the deeper dive into diagnostics. And today I wanted to cover the CMP, or the Comprehensive Metabolic Panel. That is another one of the commonly ordered tests in primary care. It's generally part of your annual blood work. And I want you to be able to understand what the results and what's tested and what the results show us. So if we zoom in here and we take a look at, these are all of the things down to this area that are generally covered in the metabolic panel. And here in the middle are your results as the patient. And then over here, we have the reference ranges. And if you'll notice, this patient was flagged for this particular number. It was high. You might see an L low or H high if your number is out of range. So let's talk about this. When we look at really this first set of numbers, gives us an indication of how your kidneys are functioning. And these are sort of high-level numbers, but they give us an indication, are you excreting properly? And why is this important, especially in functional medicine, but to everybody? Because if your kidneys are one of the key ways that we excrete toxins from the system. And if we don't excrete toxins from the system, if the kidneys aren't working properly, then we have a buildup of toxins, which is detrimental, causes inflammation, can cause all sorts of adverse effects. So that's something that's really important. Then we look into all of your electrolyte levels, if you will, sodium, potassium, chloride, calcium. Carbon dioxide is another measure in the Comprehensive Metabolic Panel, which I'm not going to go into in great detail. But this gives us an indication of, are your electrolytes in balance? And why is this important? Electrolyte imbalances can result in anything from fatigue to leg cramps to, in worst case, cardiovascular defects and problems. You can certainly, if your potassium, chloride, sodium are out of balance, that can have very strong cardiovascular effects. Then we look into proteins, albumin, globulin. This is all sort of how is your body. Again, this is another measure into kidney function, and we look at the proteins that your body is producing and breaking down, and it gives us a look at your overall health and as well the kidney function. Then these are some more numbers with ratio, and then down here we get into some rough liver numbers, liver and gallbladder. And if these numbers are out of range, that shows us whether we need to do a deeper dive into looking at liver or gallbladder. And when we look at these labs, we don't do them in a vacuum. We do them in combination with the patient, how the patient presents, what the patient's symptoms are, and what medications the patient is taking as well, which is extremely important because so many medications can affect kidney function, liver function, electrolyte balance. So these are really important numbers to look at. So I hope this was helpful in hopefully increasing your understanding of what the Comprehensive Metabolic Panel, or the CMP, is all about.